I got on my phone, but I'll be right
All
off.
right.
Yeah.
All right. As long as you're okay with us getting started, Tyler, can you start the video, please?
Yep.
right.
So it is streamed to YouTube, and I'll start the recording.
All right. Fantastic. So we will call the meeting to order at 7:01. We'll start with a quick roll call. We have Dominique Johnson, Tom Keegan, Diana Revolus, Lisa Shanahan, and Nick Sachinelli this evening. Absent, we have Manny Langella and George Serenides. So with that, we'll move right into the approval of September 23rd. I'd like to move that, and then I think we have some corrections. Ms. Shanahan, thank you. Ms. Johnson, you said you had some corrections on the minutes?
I did. Thank you, Chair Sachinelli. It's on page 3, the second to last paragraph, just some word choice to more accurately represent what I said, where it says Ms. Johnson noted that the young people in the LGBTQ community suffer. What I was more trying to communicate was that they struggle disproportionately after COVID. So maybe change suffer to struggle disproportionately after COVID. I think that would suffice. Let's see. Everything else seems generally what I was trying to get at. Maybe we could add the word mainstream healthcare between find and health. That would do it for me. I appreciate that.
All right, thank you.
Thanks.
Any other corrections to the minutes or omissions? All right, we have a motion on the floor. All in favor, show of hands. Ms. Revolus?
Aye.
All right, it's unanimous. Thank you. All right, public participation. Do we have anybody waiting from the public? I don't see anybody as an attendee, so I think we're all part of this one tonight. All right, we'll keep going. Did anyone receive any emails from the public?
Dominique, do you want to share that one of Larry's?
Sure, thanks, Lisa. We were corresponding, I believe, council members Shanahan, perhaps Keegan, and myself with Larry Locio from Chestnut Hill Road here in Norwalk, specifically about whether or not traffic agents could be utilized in the city by Norwalk PD. So I don't know if that's maybe something we bring up under new business, but I'm happy to enter that in the record if I email it to somebody, or should I read it, I guess, verbatim now?
Whatever you prefer. You could read it in if you'd like, if it's appropriate. Otherwise, if you want to forward it for the record, we could include it in the minutes. Okay.
Forwarding it is absolutely fine. I think some version of it appeared in Nancy on Norwalk this week, for those watching at home. So yes, just send it to you then, Chair. Is that sufficient?
Yes, and I'll forward it.
I'll do that right now.
And then we'll follow back up on that during the discussion items. That's fantastic. Thank you. All right. So new business tonight. We'll start with the fire department. Item 1, authorize the purchasing agent Sharon Connors to issue a purchase order to Fitness Showroom Distribution for purchase, delivery, and setup of fitness equipment at 5 Fire Station, bid number 4153 for the amount not to exceed $52,752.85. $47,670.85 will be paid by the Assistance of Firefighters Grant Program, and remainder of $5,082 will be from account noted. Would anybody like to move that item? Mr. Keegan, thank you. Chief, are you speaking on this one this evening?
Myself and a half firefighter, Tom Reich, is also present. Tom, you can unmute yourself.
Yes, sir.
Thank you, everyone, and good evening to everyone. So several months ago, earlier this year, Tom was instrumental in applying for a grant for physical fitness equipment. And it turns out that we were awarded the grant, and he can explain the rest.
Excellent.
So just some background, a lot of our equipment was very aging. And we saw a need. The maintenance program that we had to take care of the equipment was no longer useful in repairing these dinosaurs of treadmills and ellipticals and stationary bikes. So Chief Bassett, I gave him some background, assisted him in going out and getting the grant to replace this aging equipment and get our fire stations, gyms back up to into this century's equipment.
All right. First of all, I guess, would anybody like to move that item? Ms. Shanahan, thank you. Discussion? Questions? All right. Then all in favor of the item as read? Show of hands. Ms. Revelous, it's unanimous. All right. Thank you both.
Thank you.
Thank you.
Thanks, Tom.
You're welcome.
Thanks, Tom. All right, we're moving on to item 2A and 2B. Authorize the mayor, Harry W. Rilling, to execute any and all documents necessary to apply, accept, and implement grant funds for the 2021 Bureau of Justice Assistance Bulletproof Vest Partnership Grant in the amount of $20,000. 2B, authorize the police chief, Thomas Kaholic, to execute any and all agreements, documents, instruments, and amendments thereto as may be present to implement the 2021 Bureau of Justice Assistance Bulletproof Vest Partnership Grant pursuant to funding. Who would like to move this item? Mr. Keegan, thank you. And who would like to speak on this?
Lieutenant Ronzinski, this is we do this annually, and what it is a program where the officers will buy a brand new bulletproof vest. The life expectancy of a Kevlar vest is approximately 5 years. So what it gives the opportunity for the officers to do is buy a vest, then they would be reimbursed up to 50%, and that $20,000 will cover that reimbursement.
All right, discussion, questions? Mr. Keegan.
Thank you, Chairman Sachinelli. Lieutenant, your guys buy their own vests, is that correct?
Well, what they do, sir, usually is they will use their clothing allowance.
Okay.
You're issued a vest when you first come onto the job. The department pays for that. We will apply for the vest grant when we buy it through the department to get half of the reimbursement. But after the first 5 years, they're utilizing their clothing allowances, and then they would be able to take the clothing allowance, buy the vest outright, and then get a 50% reimbursement.
Okay, thank you.
Further discussion? All right, with that, we'll put it to a vote. All in favor of 2A and 2B? Show of hands. And Ms. Revolus has joined. We'll give her a minute. All right, I see her. It's unanimous. Thank you. All right, thank you, sir. So we'll move right on to the first discussion item. So this topic on fire inspectors was brought to me as a request. Essentially, the talk track and the discussion was based around having proactive attempts to address fire concerns or potential fire risk through proactive inspection measures. I'm going to open the floor to the committee, and then to anybody else on the panel that would like to speak. Is anyone from the committee first would like to lead the discussion? Mr. Keegan.
Yeah, thanks, Nick. I've been in discussion with a number of people concerning a number of issues, be it most concerning are illegal apartments. And I look at them not so much as illegal, but I look at them as unsafe. We have a couple of situations in my district where there are more people living in a single family home than are allowed by law. But I know that there are other apartments that are, and again, I'm not going to say illegal, I'm simply going to say unsafe. And to be able to ask our fire inspectors in the fire marshal's office, and there are a limited number of them, to make the inspections required of new construction, and then to see to it that these apartments all over the city are safe for the families that are living in them. It's a lot to ask. So I thought after conversations with Chief Gatto and others that possibly adding staff, be it full-time or in this case part-time, would be a good way of maybe addressing the problem. And I look at it as simply a safety issue across the city. And I think that The fire department, Chief Gatto especially, has been extremely proactive, and they've been there's an urgency to this, and I'm glad that we're addressing it. Thank you.
Excellent. Further discussion, Chief, I see, oh, Mr. Sawyer, thank you for joining. I see you're on as well. Hope
Thank
you're
you.
Well,
Thank you. Good evening, everyone.
good evening. Who would like to kind of take the mic here? Chief,
Uh,
do you have any comments or?
I just want to give you some background briefly. Several years ago, we had our full-time inspector staff of 6 increased to 8 full-time inspectors. Unfortunately, and some bad luck, we had a few inspectors that got injured at different times for long-term injuries. So even though we had 8 inspectors, we really were not staffed with 8. So we came up with the idea, and the fire commissioners agreed that we would hire 2 part-time inspectors. And originally, they were supposed to be there for 6 months just to do the residential inspections and try to make us catch up. Luckily, they stayed over a year, and I believe they would still have been there with us. But each one got hurt in Greenwich and had to leave his previous fire department job, so therefore he couldn't work for us anymore. And another very good inspector took a permanent part-time job in Darien, which I was not able to make this job permanent. So let's fast forward now. A few months ago, Broderick and I have been in discussions. The admin staff has been in discussions with other inspectors, and we feel that we should try to get the part-timers back. Last week, the fire commission had a meeting, and I brought up the number of residential properties that had to be inspected and increased workload that the inspectors are doing. The mayor and the 2 commissioners were right on board and said, absolutely, let's bring the part-timers back. So we got the okay last week to begin the process to look for 2 new inspectors. And I know Broderick is gonna interject that he wants it to be permanent. And I said to him that we'll take it one step at a time. Let's get the okay first, and then we'll worry about getting the union's blessing to make it permanent positions. But at least we got to go ahead to have part-timers for as long as I think we need them for now.
Discussion, Ms. Shanahan.
So I just have a question of how these inspections work. So if someone feels as though, as Mr. Keegan says, there's a unsafe apartment because of overcrowding, how does one work? Do you ring the doorbell? Do you need to get a warrant? Can you just tell us a little bit about the process?
Yeah, sure, Lisa. You have to distinguish between single family and 2-family occupancies where we don't have jurisdiction. And I believe most of those apartments Tom may be talking about are in those single family and 2-family home basements. The health department has main jurisdiction here, but we tag in with them for smoke alarms and egress. For the multifamilies, what we generally do, they're required to be done annually. So we send letters, we make phone calls. The problem we're having is the folks aren't getting back to us. And I had a meeting scheduled with Maura Coyne, the state housing prosecutor today, but she had to cancel. I'm beginning the process of administrative warrants or a 7-day letter, which is involved when we have existing violations. Her office will send a 7-day letter to give them a push. The administrative warrant takes quite a bit of time longer because you have to go prosecute judges, and it's just time consuming. And currently we have 3 inspectors. So I've taken on that to push this forward. But we've also discovered in chapter 105 of the charter tenement registration, where the tenements, any multifamily has to register annually with the health department. Now, if they have to register with them, if we can tie in and say, additionally, in order to complete your registration, you have to contact the fire marshal's office. And once they let us know you've done your inspection, then we'll do your registration. That will catch the majority of the folks, because I've got 28 here that are consistently doing the same thing. So I talked to Brian Candela today. He's aware of it. I believe he's going to talk to you also, Lisa.
He did reach out. That's why I'm kind of asking this question, to get the underlying basis for perhaps the ordinance change, so that we can give you the, the carrot to avoid the stick. In other
Right.
words.
Agreed. And I checked today with Danbury. I put in a message for Stratford, New Haven, and Hartford. But nobody, I believe, does this with their health department. I mean, I guess it seemed like everybody has their own little fiefdom of what they do, and they don't necessarily want to share or get involved. We're not like that here in Norwalk. All the departments work well together. So this may be an opportunity to make a change that would allow us to make sure the customers contact us instead of chasing them. That's really what it comes down to.
Great. So that's a great clarification for us to take a look at this at our next meeting. We can definitely put it on the agenda.
Okay. So I'm available. Any questions you folks have, anytime.
Further discussion? All right. Chief, Mr. Sawyer, thank you so much for attending, clarifying some of that information for us. I'm happy to hear that we have, some additional, we already have approval for some additional staffing in that area. And then obviously, we all support you guys if necessary. So feel free to bring it back to us if you need funding or anything along the budgetary items for those measures. That was a discussion item only, so there's no vote on that. Thank you, Chief. Let's move on. Thank you, Mr. Sawyer. Moving on to item 5, old business, update and discussion, starting with the police update and discussion. Who wanted to speak for the police update? And then Ms. Johnson, I don't know if now's a time to bring it up or if you want to wait till after the updates. I don't know how you want to do this one. It's up to you.
Mr.
Yeah,
Sechinelli, there was an addition to the agenda.
Am I reading an old agenda?
Under old business, there was an item 3A. I think it's 3A, and
Maybe
we have 2 additional grants that we need.
Let me see if I can pull a current agenda. Sorry about that. Would you like to, do you have it in front of you?
I just forwarded to you, Nick, too.
Thank you. Deanna, if you have it, would you mind reading it in, or even sharing a screen if that's it's okay if you just read it in.
Sure.
Please.
So, the item 3A, authorize the mayor, Harry W. Rilling, to execute any and all documents necessary to apply for and accept grant funds from the Department of Justice under the FY 2018 Edward Brame Memorial Justice Assistance Grant in the amount of $36,609. Item 3B, authorize the police chief, Thomas E. Kuhalik, to execute any and all agreements, documents, instruments, and amendments thereto as may be necessary to implement all programs through the FY 2018 Edward Brame Memorial Justice Assistance Grant pursuant to such grant funding. And then there's 4A and 4B, which are similar. I don't know if you want me to read all of them at the same time or handle item 3A and 3B first.
Yeah, so I'll move those items, and then just can we have just a brief description, please?
So these grants, the authorization for these grants have actually come in front of the Common Council quite some time ago. There was stipulations in both of, in the 2018 grant related to sharing of information with immigration. So although we had applied for and initially accepted, we never fully accepted these grants or used the funding because we did not agree to those stipulations. Those stipulations have now gone away, so we can actually access the funding. And the law department felt that it was best to, although they were previously authorized for the mayor to sign, just to bring it back in front of council, just to make sure, because there's a substantial amount of time in between.
Thank you. Any discussion, questions? I'm familiar with this topic. For the rest of the committee, was there anything that you needed further detail on, or are you comfortable with the vote? Okay. Ms. Revolusa, you're muted. Sorry.
Can you explain this more in depth?
Say that again. I'm sorry, I couldn't hear you.
Can you explain this more in depth?
So
I'm just like, can you explain it more in depth?
I'll explain briefly from my perspective, and then I'll pass it over. But these are typical grants that we've traditionally have applied for, but there was at one point a requirement to provide ICE data. So basically, we at the time, the city at the time, did not want to provide ICE information to be able to receive grant funding. So we did not take that funding. So I'm just trying to really simplify it, but we have, if that doesn't answer, we have these folks. Does that answer what you were looking for?
Yeah, to a point. It's just now in accepting it. Explain that.
So now different administration, the stipulations related to sharing of data with ICE have been lifted. So those are no longer stipulations of those grants. So we can fully accept them now without an issue.
Perfect. Okay, that's it. Just clicked. Thank you.
It's a good question. Thank you for pushing us to clarify that. Is that clear for everyone else? Is there any other questions in the group? All right, fantastic. If we'll the other items, just Deanna, for clarity, I still don't have the updated agenda, but I was prepared for this. I apologize for missing that. The other items are they listed as discussion items as well, or action items?
They're listed as action items.
Okay, so we'll vote on these first. So all in favor as for the items as read? All right, it's unanimous. Thank you. Deanna, would you mind reading in the additional items, please?
Sure. So the additional ones are for 2020. 4A, authorize the mayor, Harry W. Rilling, to execute any and all documents necessary to apply for and accept grant funds from the Department of Justice under the FY 2020 Edward Bryan Memorial Justice Assistance Grant in the amount of $33,741. Item 4B, authorize the police chief, Thomas E. Kohalik, to execute any and all agreements, documents, instruments, and amendments thereto as may be necessary to implement all programs through the FY 2020 Edward Bryan Memorial Justice Assistance Grant pursuant to such grant funding.
Thank you. Would anyone like to move these items? Ms. Revelous, thank you. Is there any questions on these items? Discussion? All right, ready for the vote? Okay, all in favor for 4A and 4B? Show us, raise your hand for sign of yes. All right, it's unanimous. Thank you. All right, now we're officially moving on to the discussion items, starting with the police update and discussion. And I guess question still stands. I don't know, Deputy Chief, would you like us to read that the email in or the question from the public, or would you like to start with your updates?
And realistically, my updates were going to be about staffing anyway. So if you want to start with that, that's fine.
All right, Ms. Johnson, did you want to formalize the question, the inquiry?
Sure, as opposed to reading the letter from the constituent from the resident, it was in response though to the article in the Hour newspaper about the extra duty assignments for our Norwalk police officers, putting a strain on available officers. So this constituent posed the question of if now was the right time to reconsider establishing traffic agents similar to what the town of Westport has to handle extra duty assignments. So I suppose that's a question we can address possibly.
So ultimately, having traffic agents would be a contractual issue, so it's not something we could just do. That would be something that would need to be negotiated with the union in terms of contract. How Westport, my understanding with Westport is they hire back sometimes retired officers, but also hire other people as just traffic agents who supplement their on the road construction jobs, directing traffic. And they're not full-time employees, or I think it's just on an as-needed basis as far as I'm aware.
Thanks, Deputy Chief. I figured it might be a collective bargaining issue. I wanted to.
Yes.
Okay, thank you.
And then, so in terms of our staffing, as everyone read in the paper, we are definitely having some serious staffing issues. As the chief had said, we're down to 169 officers from 181 is our authorized strength. Actually, in the next week or so, we will be down to about 166 with the retirements and resignations that are in process. Additionally, we have a substantial amount of officers who are out on long-term injuries or illnesses that is further complicating our staffing issues. We are actively recruiting right now. We plan to hold a symposium, like an informational session, hopefully in mid-November, to try to encourage people to come out and get their questions answered. And if they're even thinking about a potential career in law enforcement, so they can meet officers and get, kind of get a feel for what it's all about. We have had to, in order to, as the chief had said, our patrol staff is our most important staffing. We need enough officers on the street to keep the city safe at all times. And that is our first priority. So we always will be staffing that first. So there are times at this point when there are construction jobs, et cetera, that are going unfilled because we do not have the staff to cover it.
Thank you. Further discussion, questions? Ms. Revolus.
I think also this would be a part of like the reach back with engagement. But not in reading. It wasn't particularly in reading what's going on. It was having to deal with it firsthand and watching police not being able to respond to certain scenarios about like 30 minutes later, or literally watching situations where I'm seeing officers like, why you're not taking the person, and they're literally looking confused in the present or in the moment and not knowing what to do. And the fact that our community, a lot of our community, unfortunately, doesn't have that intentionality to become an officer as well. And we're seeing it also how it's hurting our schools with our officers that are in the schools. They're not able to engage in the way they like. How do we, I know you're saying just in November with the interaction, but I'm also concerned and wondering, how are we bringing in support systems for new officers as well? Things like maybe having, for example, not a counselor, but they were distressed because they were clearly dealing with a gentleman who has put himself in a drug-induced psychosis of sorts, right? But they don't understand how to deal with that. Are we connecting support systems for our cops as well to also strengthen them so that they feel that they have better, so we can gauge more officers, so on? Because I literally watched that happen last night, and you can see the officers not knowing what to do. So I'm just wondering if we're also bringing in support systems with trying to recruit officers as well, if that makes sense.
So to start with, if it would surprise me if it's a case where officers didn't actually know what to do. I'd love to discuss that specific incident with you offline to get more details so that I can determine what happened there. But one, we do train our officers in how to deal with situations like that and how to de-escalate things and how to properly respond. Additionally, for the officers, for their well-being, we have EAP services through behavioral health services that they can reach out for support that we repeatedly tell them about. We also have a peer support team. A few years ago, actually it's probably 5 or more years ago at this point, we developed a peer support team. So those are officers within the department who are trained to help other officers who are struggling or dealing with anything. In terms of major incidents that may be traumatic, we also do debriefings, mental health debriefings, with the help of our EAP services.
I think my question's being which is great. The officers themselves need that. I'm talking about in the moment, in the field, at the situation. I'm not talking about for the officer. I'm talking about for the person that they're dealing with right now, to get them off the street, to secure residents around the area. I'm not actually talking about the police officer themselves. I'm talking about police officers aren't trained in certain fields that are needed right in their care. Like, for example, you take in alcoholics, but you're not trained for that type of therapy, right?
We don't provide therapy, correct? We do not provide therapy. We are trained.
So those
we do
additional
train the
supports.
officers how to deal with those situations, though, how to de-escalate those situations and how to best handle them. Overall, within the city, we are also looking at other options of being able to deal with certain situations like that. But the officers definitely are trained in how to handle that, not to provide therapy, though.
No, right. And not to keep it any longer, just because why I'm saying this is because since there's a decrease in the actual officers themselves, if there's an increase of supports that go out with officers, not to get anybody in any physical harm, but that increase actually may help responses, if that makes sense. You know what I mean?
There are programs that are being looked at within the city.
Okay. Thank you.
Further questions? Mr. Keegan.
Yeah, hi, thanks, Nick. Chief, regarding staffing, can you just kind of brief the committee on the issues involving officers that are out injured, officers that are out sick, officers that are on vacation, and how it affects the patrol operations, which is the backbone of any department, is the guys that you put in the police cars that go out and answer the calls for service. That is what has to be filled first. Because what's been happening is we're getting some parents, and it's on social media, I'll be perfectly honest, who are talking about, losing the school resource officers. But what they don't understand is that those officers that are assigned to the schools, some officers that are assigned to the Marine units, because we don't have enough cops, that many times they're being reassigned to patrol. So could you kind of explain how that all works for the community?
Yes, in in the recent past, we have had to reassign officers from SRO duties, from the Marine Unit, from community policing. It has not affected the areas we police. Currently we have 3 SROs who are covering the schools, but we're providing additional resources with our patrol staff. So if a patrol officer who's patrolling that area has time, they're spending time at the school. So, and we've worked with the Board of Ed to then potentially, when needed, hire overtime, an officer to be at the school to help assist with coverage at those schools. So that there is always coverage at the schools. And as I had said before, our patrol force is really the vital piece to make sure we keep the city safe. So that has to be filled first. So because we have these shortages between injuries and reduction in staff right now, until we can bring our staffing back up to where it needs to be, we did need to pull from some of the specialized units in order to make sure that we are properly, have enough officers on the street doing the routine patrol and responding to calls for service and emergencies. But in that, we have made sure and have worked very, very closely with the Board of Ed to make sure that the schools are protected and are covered, and that there are officers who do go to the schools to make sure that there still is that interaction and communication. Did that answer your question or explain it?
Any further questions? All right, Deputy Chief, thank you so much for your time this evening. I appreciate all the updates, and thank you for everything you do.
Thank you.
All right, moving on. The next update for this evening is going to be the fire update and discussion. Chief.
Good evening again.
How are you, sir?
I'm great. How are you?
Good, thanks.
So I will just bring you up to date on the calls we had for the month of September. 753 calls, which average out to 25.1 per day. 9 fires of different types, 42 rescues, 391 emergency medical responses, 33 hazardous conditions, 77 public assist calls, 52 good intent calls, 149 alarms. The total incidents for 2021 are 5,563, which are up 586 from last year. And the total number of runs were up over 1,000 from the year before. And of course, we had Storm Ida, which contributed 126 calls in a 24-hour period for all kinds of different issues. But on September 2nd, we had an underground vault fire on West Avenue. We worked with Eversource to manage that situation. The same day, a boiler exploded on Glenwood Avenue, resulting in damage into the basement. September 5th, we had a watercraft rescue where our Marine Division assisted with a boat that was taking on water and transferring its occupants to Cove Marina. September 14th, we had a structured fire on South Main Street, which was a kitchen fire. And September 27th, a car fire on Washington Street, fully involved car fire, the engine compartment. Those are the calls. Fire Marshal's office for that month, they did 169 inspections. They sent out 129 notifications. 23 plans were reviewed, which brought in $450. There were 7 liquor licenses for $455. So for the month, they made $905. And they investigated 9 different calls for fires or code enforcement issues. I do want to show you one thing, if you could see this. You see our logo right there?
Yes, sir.
Okay, this is at the Stepping Stones Museum. During the summer, they were soliciting agencies to buy tiles to put on their Community Heroes commemorative wall. So we purchased 4 tiles. That's our logo. And their message was to thank the people, companies, and organizations recognized on this wall for displaying countless everyday acts of heroism throughout the COVID-19 pandemic, and many businesses and donors that bought tiles to make this wall possible. So if you go to the museum, you'll see our tiles on the wall.
That's a fantastic update, actually. I like that quite a bit.
Questions?
Questions. Discussion. Ms. Johnson.
Thank you, Chair. Thank you, Chief. I did see in the paper the article referring to the uptick in calls relative to last year. Is there a explanation as to why? Have you figured that out, or is this expected because of COVID?
It's probably related to COVID a lot, because a lot of people were afraid to call for help. They didn't want to go to the hospital. But the summer storms that we've had recently have increased the call volume. So it's hard to say really, but I'm sure that has a lot to do with it though.
Thank you very
So
much.
one thing I do want to also mention that we did hire 12 new recruits, and they started already on the shift. So everything's working fine for them. Working with the fire commissioners to interview people, 6 more for the February Fire Academy class, and we'll keep you updated when we get more on that.
Outstanding news. Further questions? Discussion? Chief Gatto, thank you so much. I appreciate your time, and thank you for all you do.
You're welcome. Thank you.
All right, we are on to emergency management update and discussion. Ms. DeLuca, how are you?
I'm good. How's everybody doing?
We're good.
So I think for the most part, I did just want to focus a little bit on Ida. I know obviously I've had some conversations with a few of you about the storm response and next steps for residents. We are still waiting for the presidential declaration to be approved. Everything did go in, I want to say last week. And now we're just waiting to figure out if FEMA will approve the assistance for residents and renters. And that's called Individual Assistance to Households, or IA. We do know that public assistance, or PA, will be approved for the municipal costs. So for example, Norwalk Housing Authority had some damage. Norwalk Hospital had some damage. So they're actually eligible to get some reimbursement and apply as independent partners, or again, private nonprofits, to FEMA directly for some of those costs. So we are hoping to hear back maybe by next week or this week what the declaration is, and then we will push out some information to residents about next steps for how to file claims. FEMA has a lot of great literature in multiple formats, languages. Again, some are a little bit text heavy, whereas others are more infographic based and a little bit easier to process. So we'll make sure that we use media, social media, websites, distribution lists. I'll probably reach out to all the Common Council members and ask you to push it out to your constituents if you have distribution lists as well, just to get the word out far and wide, to encourage people to file for claims for damage if they had them. There's usually a 60-day window once the declaration is declared, I guess. where people can apply for damage. It is all reimbursement based. So again, FEMA doesn't come around with buckets of money. Residents have to have uninsured losses and then have all the documentations, photographs, whatever else. And then even if they get a denial, there's another 60 or 90 days that they can appeal it. So again, I will definitely push out more information, but I'm cautiously, definitely optimistic that our residents might get assistance from FEMA this time. That was a long sentence, sorry. So I wasn't sure if there's any questions on Ida.
Ms. Shanahan.
Well, first of all, I wanted to thank Michelle because she's been really very closely in touch with Tom Livingston and me concerning our district. We've had terrible flooding from the top of the 5 Mile River all the way down to the mouth of the river. And so it's been really difficult, as Michelle knows, and our residents have been really, really suffering. And we appreciate all the information that you've been forwarding along to us, Michelle. And the only thing I would ask is that when you are contacting residents in our district, if you just like copy Tom and me so that we know what's going on, in that way we'll be able to, maybe take the first hit of questions and things like that, because we're undoubtedly going to hear sooner or later from them. But I appreciate so much how hard you've been working on this and all of your advocating for the residents of Norwalk.
Wonderful, thank you. Yep, I'll definitely add you guys. And I know Tom as well has had a lot of constituents that were affected. And I think other than that, we have had some conversation with some of the other departments working closely together. So planning and zoning, conservation, public works, health department on different climate related issues over the past couple months. Again, flooding related, and then just overall heat, sea level rise, the whole mix. So we've had some conversations about possible funding and just, how to work better together. The Yukon Circa, which is, I can't think of the acronym right now. It's something climate resiliency school, actually approached us about putting some heat sensors in Norwalk for the summer. So starting in May, probably lasting through September, as a great project. Again, no cost to us as a municipality, but to really measure extreme heat, vulnerability, the impact on, I can't think of the word. Again, areas around the city, we can look at beaches, more urban dense populations, more tree lined areas, to really, again, get a sense of how extreme heat is impacting those areas. And then, some recommendations. I believe New Haven just completed a study last summer. So it's a really exciting opportunity for us. So I'll definitely let you guys know more about what's happening with that, or what's happening on that front.
Michelle.
To comment on that too. So wearing a different hat when I was on the, I still am on the Norwalk Land Trust Board. We did a urban mapping that I can share with you, Michelle. And one of the things that came out loud and clear was the urban heat island that is especially in District B and down in that area. And then also the added health effects of the heat island down there, higher rates of diabetes, obesity, heart disease. So I think this is a really good and really important study. It's also been done in New York City with to great fanfare, and hopefully our new tree policy will also get more trees down there, because it can only help with dissipating the heat and bringing evaporation resources from the trees and things like that. So I'm really glad to hear about that.
Great, thank you.
Ms. Revelous.
Guys, sorry about my back and forth with my computer. I just wanted to double back on Councilwoman Shanahan's information there, because I just like to push the fact that if a lot of things are happening in our southern part of Norwalk, that's because of a lot of things that are getting impacted in South Norwalk. So having those connections and understanding those relationships to South Norwalk and Rowayton area, I also feel is a good aspect and should be definitely approached that way. Like if it's going to happen on Woodward Ave, it's going to affect Old Witch. You know what I mean? So I just think that that's also a great way to tie and understand the connectivity and closeness of District E and B.
Absolutely.
Any additional discussion? It's messing with me. Cutting between angles. This is like it's like a pro video shoot at this point. Any other questions for Michelle? All right, Michelle, we appreciate you. Thank you so much. Thank you for all that you do. The updates with this, like I said, so I'm borderline emotional because Lisa brought up the fact that this is my last meeting. But Michelle, I got to figure out how to get on your weather update emails once I'm off council, because I live by those things.
Great. We could definitely talk.
All right, fantastic. Well, thank you again.
Have a good night. Thank you, guys.
All right. The final update this evening is from the health department. Ms. Moore, how are you?
I'm doing well. How are you?
Good.
So just to start off with some non-COVID related items and to build on what Michelle was describing. So we're excited. Staff have been starting, to focus more on non-COVID related activities. We are really starting to think with some of our newer staff what our role is and can be related to climate change, the health impacts and how we get more involved in that work, because it's something we're very interested and passionate about. And you asked me what's the biggest public health issue. I think most people would say it's climate change because it impacts so many different aspects of a person's health. So excited about some of that work moving forward and partnering with Michelle and others on it. Another update is, I'm not sure if you all are aware of this, but we're a nationally accredited health department. We were the first one accredited in Connecticut, actually the first local one in New England. And we're going through a reaccreditation process right now. So on October 16th, we submitted several documents as a response to a pre-site visit. We had submitted documents like 2 years ago, and a lot of this work had been put on hold because of COVID. So we're getting back into it and getting that application moving forward, and to hopefully be able to hear good news in the months ahead about us earning reaccreditation. So that work moves forward. We also are starting to get back to looking at our substance misuse work, and where we can play a part and how do we partner with everyone else on that work. So we're thinking through some of that, and which again with the new staff who's going to be doing what. Teresa's been looking at our community health work and the different community coalitions that she and others have led, from the health department related to community health. We have the Healthy for Life project, which focuses on healthy eating and food access, physical activity, chronic disease prevention and management. We've had the Health Enhancement Community Grant and project that looked at food access, active transportation, and family support home visiting. And then she also works really closely with Norwalk Acts on health and wellness initiatives. So she and others that are part of these coalitions are looking at these different activities that we've led in the past and how do we align all of that and what does that look like moving forward. So exciting work ahead with that, as well as working with the hospital and others on updating the community health assessment and developing the new community health improvement plan in partnership with obviously the community. And then we're doing a refresher on quality improvement for our staff. I'm excited about that. So we're doing, thinking about what we're doing in the community, but also, again, strengthening our own staff so that we can continue to improve our programs and services for the community. For COVID, just want to let everyone know we're planning Moderna booster clinics next week. So that should be announced tomorrow. I believe we're going to have a press release and a flyer out for that. So we're going to be holding 2 clinics and we'll see, what the interest is and if there's a need for more after that. But we're also just trying to let everyone know about the other providers for those that are interested in booster doses. So those are my quick updates, and I was going to pass it on to Brian so he can give you the update on where we are with COVID.
Is there any questions for Deanna before we move on to Brian's presentation? Deanna, actually, if I may, I have a quick question. So you brought up the accreditation. What's the benefit of being accredited?
Yeah, so it's based on the 10 essential public health services, right? And it's all about meeting national standards, delivering public health services in the best way possible. And so, there's a lot of requirements related to community engagement, utilizing data to inform decisions, investigating health problems and health hazards, enforcing public health laws. So it ensures a community that you're, a high-performing public health department, ensuring that you're thinking about public health in a broad sense. Health equity is important. Social determinants are important. It also puts us in a more competitive position to apply for grants. Several grants, they ask about, what's your accreditation status, and they look into that. So there's the potential for more funding as well. But it really elevates the performance of the health department. It means more accountability to the community. And one of the biggest things that we've worked on with accreditation is updating our policies and procedures. Putting everything down on paper and having those, set policies and procedures. It also really improves staff engagement and staff collaboration, working together across the department. Again, it enhances community engagement. And so it also, and the other thing is the whole point of a big part of accreditation is quality improvement too. So it's about incorporating the elements of a continuous quality improvement culture within your department. So data, staff engagement, communication, all those important things, taking a look and applying formal quality improvement techniques and methods to enhance what you're offering to the public.
So you're saying there might be some benefits.
Yeah, sorry, I'm very passionate about it. I used to be our accreditation coordinator, so I love it.
No, it sounds fantastic. Thank you so much for going into that detail for me. Again, for the committee, are there any other questions specific for Deanna before we move on? Ms. Revolus.
And with the work you guys are doing, I actually connected with a great certified our nationally and our state certified naturopathic physician who was actually an ex-Pfizer chemic engineer. So he's a definite great gentleman to talk about, especially with getting different accreditations and in a naturopathic way of medicine. He's a great Dr. Bauman, great gentleman. But that being said, I also interviewed him. We had an event with him. He's a great guy to kind of incorporate into Connecticut, into Norwalk. That being said, I have a sidebar question for your health department, but it did come to me from a constituent. Just because you're in front of me, I want to ask you. For environmental situations, especially within the Meadow Street area, we're seeing a lot of dust and build up, right? So that makes me wonder about air quality, and the fact that signage isn't, there's signage saying that we have road cleaning, but we're not actually following our signage, so on and so forth. That being said, that needs to be addressed, right? But my question, especially for environmental, how much responsibility do our organizations, our companies, our industry have in creating a clean environment around where their company is versus the responsibility of the health department, the city, us? So because when our constituents call us, how much should, a company that's causing a lot of dust buildup have the responsibility of spraying air mist, for example, to clean up that air area, besides us dusting the roads or sweeping? How much of that is a responsibility for the organization, company, industry versus the city, the council, us, health department?
Sure, thank you for that question. So so depending on the situation, right, we work really closely with the other city agencies, right? Like planning and zoning is one that we work with very closely with for those types of situations. So if there's an issue where there's dust being generated, we absolutely want to make sure that it's being mitigated, that it's being watered down, it's not migrating from the area. So if there's a specific complaint or certain situation, that's definitely something that the health department will respond to and get involved with in collaboration with planning and zoning. that we frequently do that. And there's been
That's
times
what
in
I
the
reached
past-
out to you about.
Yeah,
That's
yeah.
so when we talk, we'll talk, but I just really
Absolutely,
wanted
yeah.
to know the responsibility because per the constituents, they call us, it's our responsibility, you know? But in reality, how much of it is the organization, industry, company's responsibility versus, you know, our town?
Yeah.
Yeah.
So definitely look forward to talking to you more about that.
Okay, thank you so much.
Mr. Keegan.
Thanks, Nick. Deanna, this may not be the right time to ask this, but Deanna and I spoke earlier in the week, and this is about candlelight at Norwalk High School and COVID restrictions and how it'll affect candlelight. Did you meet today, Deanna, with the Board of Ed about lifting maybe some of the restrictions?
So we meet with Norwalk Public Schools every week, and we did meet with them. So we constantly are looking at, you know, what's the latest guidance, what's going on, you know, do we need to be making any changes? So one thing we did discuss today was some of the updates related to Addendum 7, which relates to like arts programs and music, and some updates they made related to distancing. So we did discuss that today, and we're going to be hoping to meet with staff from the music and arts programs next week to hear what's going on in their perspective and see if we need to be making any updates or changes.
Are you willing to tell us what you discussed, or is it something that you'd rather not?
Well, I'd rather talk to them first, but I mean, we went over like what the updated guidance is. I can review that quickly if you'd like.
Sure.
So I have too many documents open right now. Sorry. Okay. So Addendum 7, one of the particular things that they talk about related to distancing for arts is, to the extent feasible, they're saying schools should strive to provide at least 3 feet of space between students during arts instruction, as well as during performances. In all cases, more space is better. This is especially true during times when increased amounts of respiratory droplets are actively being generated, you know, such as singing or speaking loudly, wind instruments, etc. And so the guidance talks about you can do 3 feet, but the larger the distance, the better, and it's more encouraged. So we talked about some of that. We talked about layered mitigation strategies. So if you're going to be reducing any distance, the other strategies become even more important at that time. So we talked about, you know, ventilation and masking and that sort of thing. So we're sort of talking through all of that, obviously encouraging the larger the distance, the better. But that's why we want to talk to the staff and those that are in those programs to get a sense of what's going on and how it works, you know, just an update on how things are going operationally and what it looks like moving forward.
So just the recommendation by the CDC is 3 feet. Is that correct?
This is the new state guidance for
state
from
guidance.
schools,
Okay,
from
3 feet.
SD, from the State Department of Education.
Okay, thank you.
Any other questions for Ms. Diamore before we move on to Mr. Weeks' presentation? Mr. Weeks.
All righty. Well, thank you very much, everybody. Ron Weeks here, epidemiologist. Let me just share my screen and we'll jump right into it. You know, some pretty decent news to share. So hopefully it should be coming up on the screen now. So what should be showing up is the CDC COVID-19 county community levels of transmission for the last 7 days. We've seen this map obviously before, and what's really kind of neat about it, usually it's very deep red and not usually many other colors on it, but this time around we have some more yellow, especially more the southeastern portion of the country. But nonetheless, you're looking at it more specifically in terms of the state of Connecticut. What's really cool is Fairfield County, we are in the moderate category. So that's the 3rd highest category, not number 1 in terms of the highest category. You know, there's still about 75.6% of the country that's still in it. But right now we only have 1 county for the state of Connecticut in that level. Still the majority in the substantial category or orange category. So that's 5 counties. But Tallinn just recently entered this, as well as us in Fairfield County. So, you know, good news in that regard. You know, still based upon the CDC surveillance, as you can see, the orange here is the Delta variant. It's still running the show. So that's 99.6%, based upon the forecasting model, looking at especially the time period of October 17th to the 23rd that the CDC has. And if you look at it by region, pretty much it's a big orange ball in terms of it being just Delta variant, throughout the country running the show. And this is also further supported by our state health department and their surveillance of the variants. The red indicating the Delta variant, and as you can see, pretty much all red. So in a way, it's a good thing because it's a common enemy, so to speak. We know what we're dealing with. There's been a decent amount of research now to kind of triage it and know its transmissibility and its effects, especially in terms of therapeutics and the vaccine. And hopefully, it's the only thing that shows up at this point. But, we have to factor in the fact that, we're approaching not only Halloween, but the Thanksgiving holiday in November and the holidays in December are coming up as well. And those are a lot of opportunities for travel and a lot of socialization relative to family members and friends. So that's another thing to keep in mind. But nonetheless, looking at the more immediate metrics, this is the state's COVID-19 county hospitalizations. The green line showing the state total. So as you can see, I just have to move my Zoom bar a little bit. You can see that we're at 191. And so, as you can see, for the last 2 weeks, at least, it has been indicating a downtrend in terms of the hospitalizations. So this is also a really important indicator for severity of outcomes relative to COVID-19. So this is good news. Obviously, as you saw before, like the weeks prior to that, it was a little bit of a plateau or stabilization of those numbers, but certainly not where we were before, where we were about to broach 400. So this is all very good news and reflective of, not only people following the prevention measures, but also more uptake of the vaccine as time went on. This is just another way of looking at it from perspective standpoint. This is our most recent city and town case rate map from the state health department. So this is all fresh off the press. This only came out a couple of hours ago. But as you can see, Fairfield County is pretty much only in the orange, yellow, and below that category. And the city of Norwalk is at 6.3 cases per 100,000. So that's also good news. And one thing I would like us to make note of, or a mental note of, take a look here on the right-hand side of the state of Connecticut, where it's still in the red, so the highest categorization based on the state framework in terms of their case rates. But again, we're not where we were before 4 months ago in the summertime, where we really had very, very low activity all around the state, but still better than where we were 6 months ago back in April, where we were deeply in the red in terms of case rates and activity. So still, just again, make that note of that right-hand side there. So, this is just like looking at the case rates for the big 7 Connecticut cities by population. And Norwalk's been a pretty darn good performer in comparison. So we're at 6.3 right now. Technically, we are the second lowest with Stamford at 5.5. The highest is Waterbury at 15.9, with New Haven following at 11.7. So, we're really doing really well. We're almost in step with Danbury, who's been usually steadily usually the lowest in terms of case rates. So overall, really good news in regards to our situation, especially for the last couple of weeks. In terms of, for the entire pandemic, the number of cases and deaths, we have 12,706 cases, 235 deaths. This is one thing to note is, looking at the bottom right here now, this is looking at age groupings by decade of age for the last 2 calendar weeks, which is October 10th to the 23rd. So the prior 2 weeks, just for your knowledge, it was actually very strongly skewed to the left. So our younger age groups, such as, 10 to 19 and less than 10 years of age, were actually the largest majority of those new cases that were presenting. But now it seems to have kind of wavered back to what our usual suspects. So 20 to 29, 30 to 39, and 40 to 49, all equally at 15.4%, followed by 10 to 19. So what it's suggesting is, not only with these younger age groups, because they went back to their usual routines and activities, including school and after school and extracurriculars, it's now kind of been introduced to the families and these younger families and then exposing them. And so what we can anticipate potentially, especially with the addition of Halloween and other activities, it might yo-yo back, but we'll see what happens. And, because again, this is usually the anticipated proportion relative to the age groups, just because it's been so consistent through the pandemic. But it was interesting just to see for those prior weeks, these younger age groups that got impacted. But just something to keep note, that still means COVID's in the midst of in our communities, and anything can happen, especially with these new variables with the holidays and this colder weather. It's obviously been much chillier than usual, and so people can't social distance as much outdoors. So we have to factor them. But a silver lining there is wearing face masks are much easier now because it's not as scorching hot to wear them. So there is one benefit in that regard. So we should always look at the silver lining relative to the pandemic. So this is the other map that I wanted to emphasize. This is related to COVID-19 vaccination. And it's just so amazing just to see this visualized. But, when we looked at the case rate map, and I'll actually jump back to it just so we can kind of emphasize this again. The kind of the right-hand side has the high case rates that are in the red. So then when we go back to this, you can see they have the lower vaccination. So the darker the blue, the more vaccination relative to the others. So it's just really interesting to see how they have lower vaccination, higher case rates. And then subsequently, where we're at in Fairfield County, we have one of the highest, consistently in terms of vaccination rates. And our case rates have been much lower as of late. So it's all good news in that regard. In terms of the actual numbers, and again, we like to look at it from all age groups just because we have to kind of consider susceptible populations, especially our younger age groups that are ineligible, as well as those who have opted not to get the vaccine because they are going to be a greater majority that are at risk of exposure to the virus in terms of really presenting with severity of outcomes and increasing their viral load. But also, just other things too. So in terms of initiated vaccination, which means at least getting one dose of the vaccine, we're at 75.79%. And, for fully vaccinated, it's 69.29%. So we're almost there at that 70% mark. So we really want to get over that. And we're looking forward to getting over that hurdle. But nonetheless, this is all still good news. But obviously it does show opportunities for improvement because we want to get to 100, right? We all want to get A+ here. And so when we look at it, especially for fully vaccinated, because that's where it makes the real difference in terms of mitigating, somebody's severity of outcomes. 18 to 24 still is a little bit of a straggler in comparison. It's 68.16%. And then following that, 25 to 44 at 73.34%. And then, you have 12 to 17 at 76.35. So, looking at those age groups, so essentially looking at it from like less than 45 years of age, definitely, continue our messaging and our outreach to those groups. And, if you guys also have an opportunity to engage individuals in that age range that has not sought the vaccine yet or completed their full vaccination series, by all means, feel free to nudge them. But nonetheless, we want to get to 100% all around. And again, keep in mind, these are based upon census estimates. So even with 100%, there still are going to be some stragglers because, there's margins of errors relative to these things. Another way also to look at this, and, again, State Health Department updates this every week. But, looking at it from October 27th, the relative risk essentially with unvaccinated versus fully vaccinated individuals. If you're unvaccinated, it's 5 times higher risk of COVID-19 infection, 18 times higher risk of COVID-19 death, and 18 times higher risk of COVID-19 hospitalization. And so the State Health Department also has recently started age standardization for this. So these are even more reflective and more accurate in terms of the current situation for the state of Connecticut. So again, the message here is get fully vaccinated. That's where it really makes the big difference, especially in mitigating not only infection, but more so death and hospitalization, which none of us really like. And so with that said, flu surveillance is also another important thing because, flu is still in the mix here. State of Connecticut is still in the minimal categorization, but it's not the lowest of that subcategory. So just keep in mind that we're like in the middle of that. And so things have increased a little bit. We also have to factor in that we're in the tri-state area. So New York and New Jersey tend to have the higher numbers, especially with even the previous flu week. New Jersey was pretty high. They were actually in like the moderate category. So it's good to see that it reduced a little bit, but it still means it's kind of jumping around. And so there is risk of exposure relative to just that, to not only that. But in addition to that, looking at it from a country perspective, you can see how like the Midwest and the Southwest, you have a little bit higher activity as of late relative to flu. So especially if people are traveling, that's another thing to kind of factor in as well. And so also, just a reminder, I know I showed this last time, but I just want to really emphasize this because we do have these resources available for testing, and ensuring that we don't create scenarios where people go to school, go to work and expose others. Keeping an eye out for the symptoms associated with COVID-19. It can take 2 to 14 days from exposure for somebody to manifest. And that can include, fever, chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste of smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Say that 10 times fast. But long and short of it, keeping in mind, these vague symptoms such as, fatigue or muscle or body aches but also much more stronger indicators such as loss of taste and smell, and obviously fever or chills. So it's just really important to keep an eye out for that, not have these people run the risk of exposing others. And so also seek testing. And while they're waiting for the test result, not showing up to these facilities or other capacities and kind of defeating the whole point. Again, like to emphasize PCR testing, and that's especially important for asymptomatic individuals. Antigen testing is not really appropriate. It's really for symptomatic individuals in their first 4 to 5 days of symptoms. But, get tested, and if you can get the PCR tested, it is preferred. Again, this is just emphasizing the publicly endorsed testing site that, has been coordinated with the city and the state, with Semaphore, the company, Veterans Park, 42 Seaview Avenue, 5 days a week. Definitely get tested, and keep in mind if there's inclement weather like we had the other couple of days, that might also impact the schedule. So also check those out on the social media profile for the city to see if they are potentially canceled. Also you can check out 211 if you're interested in other testing sites, but also our testing webpage. So that's norwalkt.org/testing. And again, all this information and as well as the mayor's remarks are in the mayor's weekly COVID-19 report. It will come out tomorrow early afternoon, accessible via the city webpage as well as Twitter and Facebook. So definitely check that out as well. Again, I just want to mention really quickly about mosquito surveillance. Fortunately, the weather's getting cooler, so there is that also ancillary benefit of mosquito activity reducing, and also opportunities reducing as well, because more people are going to be indoors as well as wearing more layered clothing that the mosquitoes can't penetrate. But nonetheless, we did have, according to the webpage for the Connecticut Agricultural Experimental Station, we had one more West Nile virus positive human case, and it showed up in Berlin here, as you can see with the little red human figure that they have there. So it is something still to keep an eye out for until we get that solid freeze. And so looking at the weather forecast, it's still teetering around getting closer to freezing temps, but it's not quite there yet. So we still have to keep an eye out for it. And again, I think I might have emphasized before, Voluntown, which is on the super east side of Connecticut, so all the way over here, did have, the Triple E detected. So that's still also something else in the mix. Say, for example, if somebody visited there. But we're still holding steady for the city of Norwalk with 9 West Nile virus positive pools of mosquitoes. So just wanted to mention that in the midst of everything else. And that is my presentation. Thank you.
Thank you. Any questions, discussion? I had a quick question about the testing. Are we finding now that the at-home tests are just as reliable as the tests at actual locations, or this is, I guess, for Deanna too. Or just in terms of reliability, can we have some confidence in all the at-home testing that's now available?
Yeah, I could start. So at-home testing, there's 2 tests that are available, which technically are also available in the community. And that is the antigen test or rapid test you might have heard, as well as the PCR test. And so if somebody did the at-home antigen test, they could just do it at home. They don't have to do really any other kind of special actions. They wait for the results, which I think take like 30 minutes or something like that. For the PCR test, they have to collect the specimen, swabbing their nose, and then they would mail it out, and then they would get a result. So the caveat with at-home tests is, you're at the mercy of the quality of collection of that specimen by that individual. And so when it comes to using that result in the case of contact tracing and other things, first of all, we won't get a copy of that result like we do get from healthcare facilities when somebody sees a qualified healthcare provider. Secondly, there is that standardized practice and the training that a healthcare provider does have to collect that specimen. And you also have the intentional as well as unintentional risk of somebody when they're collecting the specimen, because maybe they want to go to work. And so they're going to use it as an example. Hey, it's negative, but maybe they do have COVID just because they, unfortunately just collected the specimen incorrectly. So these are the caveats with at-home testing, let alone with the antigen test, especially, there's a shortage of those right now. So even healthcare providers, as well as pharmacies that sell them over the counter, there's a real shortage. And so in some ways, it's a good thing. Again, this might be putting my 2 cents out there because the PCR test is a better standard and a better test to have somebody get tested for it and give us a much more reliable result. But also, it's also suggestive that a lot of people have bought these up. And was what caused the shortage. And so we've been also dealing with this in terms of contact tracing where people have done at-home tests. And so we do consider, if somebody does test positive when they're doing at-home tests, we do factor that in. But it is preferred that they, get tested at a healthcare provider. And really, the result would really only really does count when it's really, if they're doing the at-home tests, it can be a medical provider has overseen it, so the collection of the specimens, so and they can attest to it, so they can provide some written documentation. Say, I saw this patient collected themselves. It's valid. So that is really what the preferred method is. So at-home tests kind of have confounded the process. It's great to make this readily available to the community, and it's good for an exploratory measure for people that just initially think, hey, I don't want to go to a testing site, but I'll just go to the pharmacy next door, get this, and just see what's going on. It's good in that regard, but it shouldn't really indicate and influence contact tracing as much, and especially diagnosis from a healthcare provider. It's just important to emphasize that. So that was probably a long-winded answer, but
No, that was fantastic. And the reason I bring it up is because there is availability of these at-home tests, and a lot of the symptoms that you mentioned are similar symptoms to that you receive in the change of seasons. The leaves are changing, allergies and so forth. So it doesn't make sense that you think you might have these allergic reactions to just take the at-home test, or should you still be going and going to see a physician? So you answered the question, but I just wanted to give you some background on why I was asking the question.
No, exactly. It's great for exploratory reasons. The other benefit of actually going to these testing sites is then you could charge it to insurance. There is no real out-of-pocket expense, whereas if somebody's going to these pharmacies to buy these over-counter tests, the antigen tests are somewhere around like $20, $30, $40. PCR ones that you have to mail in are like sometimes around $100. So in terms of expense, as long as somebody does have some level of insurance, it might be better to actually go to these providers, because then there's no out-of-pocket costs too, other than travel. So that's another thing to factor in as well.
Oh, thank you. Any other questions? All right. Brian, thank you so much. That was a fantastic presentation, and thank you for fielding the questions. Deanna, same. Thank you for everything that you do. I do appreciate it. It was you always throw a lot of detail in these presentations. So I'm at this point, the point where you get to all my questions before I even can ask them. So thank you for the detail that you put into everything. I guess with that, we'll look for a motion.
Mr. Sechinelli, actually, before you
yes.
close the meeting, could I
Absolutely.
interject one more time? Sorry.
Yes, please.
Deanna reminded me as she spoke of the health department's accreditation. The police, I should have mentioned, the police department is also undergoing our accreditation cycle. We're in the 4th year of our cycle. We've been accredited since 1995. And our assessment period is November 8th through 10th. So on the 9th, Tuesday the 9th, we will be holding a public hearing for the assessors to be able to talk to the public, for public to come in to talk to the assessors. The assessors will not be here in person. The assessment is being done virtually, but we will be testing the council chambers for the maiden voyage of a hybrid meeting, where we will have the assessors on their computers from home. But we wanted to make sure that we offered the public not only the Zoom option to speak to them, but also to be able to come in person to be able to speak to them if that is more convenient.
That's
so
fantastic.
that will be Tuesday, November 9th at 6 p.m.
Thank you. I was gonna ask the time. So and I guess for anyone here that would like to attend, it's open to all, correct?
Yes, and it will be publicized.
All right, fantastic. Thank you. Thank you for bringing that up. Ms. Revelous.
I don't hear you.
Your volume comes up as you talk for a little bit. No, we can't hear you. Nope.
Oh, looks like she's connecting a different.
Can you hear me from here?
We can, yes.
Okay, I'm so sorry. This computer all day. So before a motion to close, I just wanted to say, Nick, you've been an amazing chair. We are going to miss you, and thank you so much for being the help and the guidance that you've been for me for this year. You're greatly appreciated.
Thank you so much. I'm gonna miss all you guys too. It was always very enjoyable working with all of you. This is my favorite committee to not just chair, but to sit on. We always had the most interesting topics, such a great group of people to work with. And I really appreciate you saying that. Thank you.
Thank you for your service.
All right. If there's nothing else, I guess now we will look for a motion.
I gave that motion. I said it first. I just wanted to
All
keep
right.
everything else sugar coated. We love you, but I gave that motion.
Oh, fantastic. So there's a motion on the table. All in favor? Thank you. Have a good night, everyone.